We're going to talk about diastasis recti, diastasis recti, potato, patata. You've probably heard it pronounced both ways. And just like its name, what it actually is just as mysterious. So you'll hear a lot of people talking about diastasis. Some of them are scary. Some of them say don't worry about it at all. We're going to try to clear the air on this a little bit today. I'm going to give you as much education as possible so you can empower yourself with this knowledge and then do what you need to do to keep yourself safe as you heal through postpartum. Now, diastasis recti is the separation of your rectus abdominis. Your rectus abdominis are your six-pack muscles that are those ripply muscles, if you think about the muscles on a bodybuilder. And what happens during pregnancy, because our belly is growing and expanding, there's connective tissue that runs from your xiphoid process all the way down to your pubic bone that holds those two halves of your rectus together. And as your belly expands and grows, that connective tissue, fascia, it's also the linea alba, that linea alba starts to stretch, and you can think of it as a rubber band. And it's made to do that. It's made to stretch to accommodate that growing baby, and then it is made to bring itself back together in postpartum. But what happens to a lot of bodies as they're growing and stretching is because we don't have this proper diaphragmatic breathing or movement functions in our bodies. What it does is puts undue pressure on that linea alba. It's already stretched to its max. That rubber band is really taut. And then we move or breathe incorrectly and we just add some extra outward force onto it, causing it to stretch beyond the point of it being able to bring itself back together. And it's kind of like saran wrap. If you stretch it too far, it doesn't have that rebound. So what happens in postpartum is that we go into motherhood and we have that lower belly pooch, or it looks like we've got that bulge through a certain part of our abdomen. And it's not fat, it's not left over from the baby, it's actually that linea alba that's been stretched, and the two halves of your rectus are pulling apart versus being nice here, nice and together here at the front of your body. So what do we do to prevent that? You've been doing it throughout this entire program. You've been learning how to breathe into your diaphragm. You've learned activation, proper activation of your pelvic floor, contraction, relax. You've tapped into those deep transverse abdominis muscle, that deep wrapping muscle that hugs the abdominal wall back towards you. And you've learned how to coordinate this entire core canister so it works together. That is the prevention and the rehab for anyone that is experiencing this condition. So what do we do with that information now? In postpartum, we make sure that we get that diaphragm turned on right away, because postpartum is going to send you into a lot of muscular imbalances. That diaphragm was also really compressed by the end of pregnancy, so it starts to get a little amnesia by the end, and we have to make sure that we're taking those full breaths, coordinating it with the pelvic floor. Remember, your diaphragm and your pelvic floor are bookends, so as you breathe in, the pelvic floor relaxes. As you breathe out, that pelvic floor lifts. We want to make sure that that coordination is functioning properly in our bodies. And we want to make sure that when we're going through these demands of motherhood, taking care of a baby, getting up, getting down, rotating, all of those things in our lives, that we're using the muscles in the proper way. If we twist, we're going to hug those muscles towards us. If we lift something heavy, we're not going to bear down and push out. We're actually going to wrap those core muscles in. So training the body to respond to those extra loads and those tasks to make sure that we're protecting the core and bringing everything back together. So that core breathing belly pump is magic, and that's all you have to master. I don't want you to go into that hole of research and thinking of all of the terrible things that could be going on. I want you to fix your breath, coordinate it with your pelvic floor and this deep inner core muscle, and that is step one. Once you master that, if you're still having trouble getting all of this back together, then you can take the step to see a PT. You can also see a PT, a women's health PT simultaneously, PT, OT, anyone that specializes in this, to make sure that you are doing this work correctly. I'm going to give you some tools here to start to do a self-check. Now, it's important to note that that linea alba does not come back together just because the baby is no longer in your body. This takes weeks. It could take months. It could take up until you're done breastfeeding in order for that gap to do the full closure that it's going to do on its own. So take this self-check with a grain of salt, because if you are really early postpartum, know that you're gonna feel some separation, and that separation is normal and it is okay. Bring yourself down to the floor. Bring those hips underneath you. Come into that parallel position with your legs. And then the first thing I want you to do is find the muscles that we're talking about here. So if you find that peak of your rib cage, I want you to take your fingers and just press down there like you're jumping up and down on a trampoline. Now, if you got that dark line down the center of your belly during pregnancy, it might still be there. That's your linea alba. And I want you to follow that line all the way down to the belly button, down to the pubic bone. Now, most of us have a linea alba that is pretty intact and pulled together up top. Sometimes that's not true. Sometimes we have separation up here, just depending on where we were with our posture during pregnancy. But you should feel a certain amount of tension. So if you're jumping up and down here, it should feel like there's a little bit of a rebound. And as you go down through that linea alba, we're not doing any engaging of the core right now. You might feel some spots that feel a lot softer than they did up here. And that is just a place for you to take a mental note to know that you may have some separation there. The second check that we're gonna do is with our core turned on and those rectus abdominis muscles, the six-pack muscles, also turning on to really show us where that separation is. I'm gonna take this hand behind my head and I'm gonna take two fingers facing me, and I'm gonna start right there at that xiphoid process. And what I'm gonna do is lift my head and shoulders up, and then I'm gonna take that same check down through the center of my belly, all the way down to my pubic bone, coming back up, noticing the place where it feels like there might be a little valley or a hole. And when you find those places, you can kind of dig in. Maybe you put in a third finger, maybe it's wider, and you're just noticing where it is. The most common place to see or feel the separation is 2 inches above to 2 inches below, because if you think of the place of the belly where it was rounded or stretched out the most, it's gonna be in that area. And then bring yourself down. Now, what I want you to do is take a core breathing belly pump right here from your back. Exhale, lift your pelvic floor, wrap or zip up the front of the body. Feel everything wrap towards you. You're gonna go back into those places where you felt softness or a divot or a valley. Use your core breathing belly pump to get you up this time, hugging those core muscles towards you, and go back in there. Find that spot, take an inhale, release, exhale, go really deep, lift the pelvic floor, wrap lower, middle, upper abdominal wall, and see if you can produce a little bit of tension right there through that place where you had softness before. Now, if you can feel those muscles tighten up underneath you, you are well on your way to healing that separation. And as you go through your workouts, that is the specific location that you're gonna pay attention to the most. When you go into that core breathing belly pump, during your rotation, during any of your leg series, anything, I want you to think about that area specifically, drawing itself back together, tightening up those muscles underneath what you just felt as you put your finger there. And then give yourself a few weeks. Practice this work every day. Go into those deep core breathing belly pumps, working on that area, test it out, come back to it a week later. Don't test it every day. Give yourself some time to strengthen and heal before you go into that second check. Okay, I hope this information is helpful. If you have any additional questions, I know this is a confusing topic, please reach out to me directly and I am happy to chat.